What is self-injury? Self-injury is when someone intentionally inflicts harm to him or herself. This results in tissue damage and is done without suicidal intent. Self-injury is done to obtain relief from overwhelming distress. It most commonly includes cutting or burning oneself. Other types of self-injury include stabbing, excessive rubbing, and interfering with the healing of wounds. Research shows that 18 to 30% of adolescents and young adults have self-injured. It frequently occurs in adolescents who, at other times, have thought about or attempted suicide. As a result, there is a significant risk of suicide and suicide attempts among teens that engage in self-injury. One recent study found that 47% of those that engage in self-injury become suicidal at some point. Non-suicidal self-injury versus suicide. Those that attempt suicide have the intent to die or to end consciousness. They feel hopeless and helpless. They typically do not feel better after an attempt. Usually they use one primary method, which is different than the method of non-suicidal self-injury. It's a high lethality and usually requiring medical attention. Those that engage in non-suicidal self-injury have the intent to feel alive, to cope with life, and/or to avoid suicide. They may experience periods of hope. They typically experience relief after an act of self-injury. Multiple methods are often used. It is a low lethality, rarely requiring medical attention. Earlier in this presentation, we had a chance to view national and state data regarding deaths by suicide and suicide attempts. Now let's look at possible risk factors for our own students within Pike Township. A recent survey was completed with Pike High School seniors that addressed adverse childhood experiences, or ACEs. Adverse childhood experiences are stressful or traumatic events, including abuse and neglect. They may also include household dysfunctions, such as witnessing domestic violence or growing up with a parent who has a substance abuse disorder or other mental illness. Out of 468 seniors who completed the survey, 341 reported experiencing one or more ACEs, for 73%. 211 out of the 468 seniors reported having two or more ACEs, for 45%. And 85 out of the 468 seniors reported experiencing four or more ACEs, which is 18%. Research shows that ACEs in any category increase the risk of attempted suicide by 2 to 5-fold throughout a person's lifespan. The Metropolitan School District of Pike Township has a Board of Education policy addressing student suicide prevention and awareness. Policy 5350 states that all corporation personnel should be alert to students exhibiting signs of extreme depression and/or suicidal ideation. Any signs or the report of such signs from another student or staff member should be taken with the utmost seriousness and may warrant a follow-up based on implementation of the intervention procedures. The superintendent has developed administrative guidelines regarding the intervention procedures, which includes the following. Step 1, stabilization. If a student is presenting with signs of suicidal thoughts, it is important to remain calm and never leave the student alone. Converse with the student and ask if they are thinking about suicide. Talk to the student without judgment and actively listen. If possible, remove any dangerous weapons from the student or the environment. If the student agrees, accompany them to a safe area to meet with a school mental health professional for assessment. Step 2. Assess the risk. This is completed by the school administrator, school guidance counselor, or school social worker. The school guidance counselor or social worker can complete a suicide rating scale to determine the student's level of risk. Step 3. Take appropriate action based on risk. Depending on the level of risk, various interventions may occur, such as contacting Pike Police, providing referrals to mental health counseling and/or inpatient assessment, and completing a safety plan with the student and their guardian. Step 4. Communicate with appropriate parties. The school mental health professional and/or administration will communicate with the guardians regarding the assessment and the recommendations. Step 5. Follow-up. School personnel will develop a plan to support the student at school. The policy continues by describing the state-required suicide prevention training for all staff in buildings with grades 5 through 12. For additional information regarding this Pike policy, please review Policy 5350 under the Board of Education documents. The following slides 6 through 9 are local and national resources for suicide prevention. As a disclaimer, except for the review to ensure compliance of the materials with the policies of the Board of Education of the Metropolitan School District of Pike Township, the views expressed, as well as any programs, activities, or events which may be described in the resources and cell phone wellness apps, have not been sponsored, endorsed, approved, or otherwise reviewed by the district, the superintendent of the district, or other personnel of the district. Furthermore, the district, the superintendent, and the personnel are not responsible for the content of these materials and have no responsibility for administering supervision of any of the programs, activities, or events which may be described herein. Local emergency resources include contacting 911. If a person is presenting with suicidal thoughts or is in a state of mental distress, you can contact 911 and request a crisis intervention team officer. These officers are trained in mental health and can help assess and de-escalate individuals. There are also several crisis services provided by local community mental health centers, including St. Vincent Behavioral Health, Cummins Behavioral Health Systems, Midtown Community Mental Health, and Community Behavioral Health. There are many national resources available to provide support and/or education regarding suicide prevention and mental illness. There are great resources to pass on to others who are presenting with suicidal ideation or if you have a loved one who is suffering from mental illness. Resources include 24-hour crisis numbers or websites with information regarding suicide prevention. These resources include the National Suicide Prevention Lifeline, Suicide Prevention Resource Center, American Association of Suicidology, the Society for the Prevention of Teen Suicide, American Foundation of Suicide Prevention, the Trevor Project, National Alliance on Mental Illness, To Write Love on Her Arms. Additional resources include text lines, crisis line or text CSIS, Teen Suicide Hotline, the Crisis Text Line, Look Up Indiana, and Remedy Live. Two mobile apps have been developed to support suicide prevention. These apps are Safety Plan and MY3. Individuals at risk can utilize one of these apps to keep their safety plan in a convenient location, readily available for consultation if suicidal thoughts occur. Suicide Lifeguard is a free mobile app that provides information on suicide warning signs, how to ask about suicide thoughts, how to respond, and where to refer a person. Headspace and Calm are both meditation apps that are great for mindfulness, relaxation, and self-regulation. These are wonderful tools for anyone and can be used to decrease anxiety and increase coping. Given the prevalence of suicidal ideation, suicide attempts, and death by suicide, you may be a survivor of suicide loss or have or had suicidal thoughts yourself. Please know that you are not alone. Feel free to reach out to any of our Pike guidance counselors and social workers listed on this slide for support and assistance. Should you have any further questions or want additional information regarding suicide prevention, please feel free to contact any of the Pike staff members listed. This concludes our presentation. Thank you for completing this training on suicide prevention and awareness.